Okay, hello. Today we're going to talk about how to set up a pump. This is the first time mom using a pump. Today we have a Medela pump and style. And when I do a test run for mom to try and figure out what size flange she needs, I'm going to connect just one size at a time, or one side at a time, because sometimes moms have different size needs for different size flanges for her breast. So over on this pump, if you plug the one side over here, then you can operate this. If you're operating both at the same time, you just plug it in there, and then you would hook up the other cord on this side. But we're going to do just a quick test to see where mom's at. So as far as setting up this pump, if you look at the pieces of this part of the flange, you're going to connect it to the back side here. And you want to make sure that the white disc is in here. This actually helps with the air, and as the air is flowing through and the milk is flowing through, if this is not in here or if it's torn, you will lose compression. So this goes inside the bottle here, and this is a standard 24 size flange, and it's going to go right on there. So I have different size flanges. This is a 24. This is a 27. It's a little bit larger for the nipple to flow through. And then I have some pump and pow flanges, and this is what they would consider their medium, and this is considered their large. So as we work through this, we will figure out what mom needs. So are you comfortable?
Yeah.
Okay. So we're going to start off with the first flange. And as we turn on the pump, we're going to turn it on here. The faster it flows, you can hear the sound or the motor. This is for the initial letdown phase. And then if I were to hit this button right here, this will convert it over so that it's pumping at a stronger suction, slower speed, more like what the baby is doing. So we're going to push it back to the other side. Mom is going to set it up and center her nipple. And what we're looking for is how well the nipple flows in the shield. I'm going to ask her how comfortable it is.
It feels comfortable.
It feels comfortable. But there's a lot of gap going on, and I don't know if you can capture that, but I'm going to go ahead and bring this camera in close and let you see that there's a lot of gap there. We actually don't want the nipple to rub on the sides of this flange, but we also want to make sure that she's getting her areola to come through, because when babies are breastfeeding, they're actually breastfeeding, not nipple feeding. So I'm going to back this back up. We're going to actually, let's see. All right. Okay, so we're going to take this one off. Capture it. Okay, good. And then we're going to try the next size, just so she has something to compare it to. That was the 27. We're going to try the 24. And how does that feel?
It feels better.
It feels better.
Yeah.
It is filling in a little bit more, but yet at the same time, let's have you take a look. At the same time, there's still some room for the areola. Now she is pretty firm, so it could be that it's that she's just really firm. We're going to change the power setting to a slower, and then see how that feels. How does it feel? Can you go up any higher?
Yeah.
Okay, so we're gonna adjust. We're gonna adjust this here to comfort. I can turn it down. Actually, it was already up, so I'm going to turn it to comfort. So tell me if it feels better down or if it was good at.
It's fine either way.
It was good.
Yeah.
Okay. So what we want to make sure is that mom is not experiencing tenderness. So what she wants to have is comfort when she's pumping. Pumping should not hurt, just like breastfeeding shouldn't hurt. So we're gonna go back here and take a look and see. It's pretty good. It's pretty good. She is getting milk flowing. You can kind of see that she's collecting milk pretty quickly. And it's a decent fit, but I'm going to test out the other size flange to see if we can get a comfortable fit. So break the seal here. Okay, got it? Good. And we're gonna put this one on and see how that one feels. It's a different angle, so you're gonna put it a little lower. There you go.
Like that?
Yeah. There we go. How does that feel?
It feels more comfortable.
Way more comfortable, huh?
Yeah.
And she's getting even more spray. If you can see that, it's actually flowing even more. And this is a pretty good fit. It's compressing the areola. It's not pulling in her breast tissue, which is perfect, but it's also not pulling on her nipple. Her nipple's not being rubbed up against the side. So on a comfort level, where do you think this is for you?
I think this is the most comfortable
so far.
Yeah.
Yeah. And it's successful too, because she's actually doing a really good job of just spraying right in there. But for a good measure, we will try one more size flange. We're gonna go down one size because we always want to make sure that we have the best fit. I have a feeling this one might be too tight, but we will find out. Oops. There we go, try that one. And a little bit.
Yeah, it's not as comfortable.
Not as comfortable. Okay, there you go. So we now know that this one is the better fit. So go ahead and break that. Okay, good. And then we want to, whoa, good catch. We want to test the other breast. So if you want to switch, we're going to go back to the original one. Well, actually, we're going to start with the smaller one this time. Just going to give that a try. And we're going to switch it back over to the quick letdown so we don't hurt her. How does that feel?
It feels okay.
Feels okay.
Yeah, it's not as good as the green one.
But it is
It's
flowing.
working.
So I'm going to turn it to a regular pump. And how does that feel?
Feels okay. Feels good.
Okay. Let's see. And we're getting some sprays in there. You can see that, but I want to change it out. So go ahead and change it out. Let's put this one on. I'm going to hand it over to you. There we go. And you can see, actually, you can see she's getting a lot more spray.
It's more comfortable.
Yeah, and it's hitting here, so you need to adjust it so that it's not quite hitting there. Yeah, it's a little different angle, so you have to play around until you find it. So you have to drop your breast in there a little bit lower. And let's, yeah, keep adjusting till, there you go, that's better. And you're getting more milk than you were with the other one. And how's the comfort?
It's 100% comfortable.
100% comfortable. Yay. And that looks like a good fit. All right.
Yep.
Good job. Well, if you have any questions, I always recommend that every mom get fitted for the right size flange. Again, the pump came with the standard 24 or it came with a 27. But neither one of these were actually the most comfortable for her. She ended up with the pump and pow, and that would be the medium. And every mom should be tested for the right size fit for her breast. Thank you.